Welcome back to the Sunday Business Page.
Pennsylvania Governor Tom Wolf says the opioid crisis remains a disaster emergency, though the number of deaths from drug overdoses may be dropping. Last month, the governor signed his 6th consecutive 90-day disaster declaration. Highmark Health and the Allegheny Health Network have begun new initiatives to deal with the crisis. A $5 million federal grant will be used to increase the number of enhanced substance use screenings and intervention services. And there is a new enhanced pain management program that relies on a more holistic approach rather than controlled substances to treat a patient's pain. We're joined today by Dr. Cesar DeLeo, Vice President and Executive Medical Director of Highmark Health, and Dr. Jack Cabezi, Chair of the Allegheny Health Network's Pain Management Program. Doctors, thank you very much for being with us and for all your efforts in this important initiative. Let me just ask you first, this is still a problem. I know lots of folks think we talk too much about opioids, but it's because it's such a critical issue, is it not, Doctor?
John, it is. It continues to be an issue in which people are dying left and right. Pennsylvania has the highest number of deaths from opioids of any state in the nation.
Really?
That's the equivalent of 15 people a day who die in Pennsylvania.
And it's something that we can do something about.
It is a treatable disease. It's a difficult disease, but we can overcome this with treatment.
Well, let me ask your colleague about the $5 million federal grant that you got. How important is that in part of the treatment efforts here in southwestern Pennsylvania, Doctor?
It's extremely important. So we've got $5 million that are being funneled into Allegheny Health Network from SAMHSA, which is a federal side that oversees drug addiction and substance use disorders. And what it's looking to do is something called SBIRT, screening and referral to treatment. So we're looking to treat and screen people in the primary care facilities, approximately 25,000 people over the course of 5 years. Prevention is key, and if we detect substance use disorder, get them in the appropriate treatment path.
And then you're also involved, Jack, in this pain management effort, which would really, I mean, the whole notion of trying to treat substance abuse with more opioids makes little sense. And yet if you have pain, that is usually how you are treated, right?
Well, for the longest period of time, chronic pain was treated with opioids, and that was considered standard of care for the longest period of time. But now we're looking at treating pain with a multidisciplinary program. And what we mean by that is bringing patients into the pain program, evaluating them, and determining what path we should take them down, whether it be interventions, procedures that we do, acupuncture, medical massage, nutrition, cognitive behavioral therapy, group therapy, biofeedback. The thought here is that not every patient needs everything, but every patient needs something.
Right.
And then we're looking to wean their opioids off if possible, and in many instances we've been very successful in doing that.
Yeah. Let me ask you, Cesar, if I could, about the impact on mothers, those expecting children, and even those with children. This has got to, if you are a pregnant woman on opioids, there has to be an impact, is there not?
If you are a woman who has an addiction problem to opioids, you're at risk for pregnancy, and pregnant individuals have to care for their unborn children. The problem with this condition, and I have to say that it's highly stigmatized. People think that people are doing this voluntarily, and they are not. This is a brain disease. It rewires the brain, so people do things that they would never normally do. But it's important to work with women who have an addiction problem, who are pregnant, to get them in so that they get their prenatal care, they get appropriate screening, and they get treated with a medication so that they are not taking dirty street drugs, because this will have a profound impact on our society if we have an entire generation that is experiencing learning disabilities, congenital defects, complications from early delivery.
And you have services that can help mothers in this situation, is that right?
Absolutely. We are very proud to have the Perinatal Hope Program at the West Penn Hospital and satellites throughout Western Pennsylvania, and that's a program that caters specifically to women with addiction and pregnancy.
And we have the number up on the screen, so if anybody has family members or know of others who are in this situation, and we know there are thousands of people who are addicted to these opioids. Sometimes they don't know it, sometimes they do know it, right?
Well, that's true. There are many people who remain on opioids for perhaps iatrogenic reasons. They came out of surgery or they developed a chronic pain problem, and they've been on opioids for years. And not only do they not know that they have a substance use disorder, but the prescribing physician may not know that they have a substance use disorder. Hence this $5 million grant and the ESPERT study that will allow primary care physicians to screen these people, evaluate them, and get them into treatment.
Right. And, you know, if the unfortunate happens and somebody passes away, Highmark has this caring place. What's the Highmark caring place all about?
Well, John, it's a very sad situation that we end up in many circumstances. We have grandparents raising children because the children's parents have passed away from drug overdoses. So we are very proud to have the caring place. It's located in downtown Pittsburgh on Stanwyck Street. It's available to anybody free of charge, and we have satellite caring places throughout the region.
How does it work? Is it for families then who are grieving, who need help in that grieving process?
Yes, families come in, the children, the caregivers, and they help them through play and counseling and other therapies to get them through that process, and they create a support group for them.
Right. And this is particularly helpful for children.
Absolutely.
You know, doctors, I would just want to thank you again for coming on the show. The opioid epidemic, really, as you say, I still can't believe Pennsylvania is #1 in opioid addiction and deaths. And I appreciate very much you coming on and sharing what you're doing at the Allegheny Health Network. So, again, keep up the good work. I know we'll see you again. Thank you.
Thanks, John.
Appreciate it. We'll be back with more of the Sunday Business Page in just a few moments. Stick with us.